Good evening. I'm Kelly Collins, and tonight I'm going to be talking to you about cardiac interventions. When working in a physical therapy setting, you will come into contact with many patients that may exhibit cardiac problems. Tonight I will be discussing the importance of exercise in cardiac patients and go over two of the most common cardiac conditions that you may come into contact with out in the clinic. What is the importance of exercise? The Center of Disease Control and Prevention recommends moderate intensity exercises for at least 30 minutes on most days of the week. And exercise has been shown to decrease the risks of many health problems. Therefore, exercise is important to help improve most heart conditions. Cardiac rehabilitation exercises are goaled at improving exercise tolerance and avoiding cardiovascular complications and other adverse conditions. The benefits of exercise for primary and secondary cardiovascular disease have been thoroughly documented. Exercise training increases cardiac function and capacity, and also decreases myocardial oxygen demands at any level of activity. Although exercise can improve capacity and recovery of autonomic nervous system activities, there is an increased risk that exercise may precipitate cardiovascular complications, such as silent symptoms of ischemia, arrhythmias, or abnormal blood pressure. So as a PTA, when treating patients with heart conditions, it is important to pay close attention to the patient and monitor their heart rate and vital signs frequently. One common cardiac complication is hypertension, which is caused when blood pressure is persistently high. Like when, for example, diastolic blood pressure is over 90 milligrams of mercury, and the systolic blood pressure is greater than 140 milligrams of mercury. Hypertension or high blood pressure can be hereditary and caused by greater environmental stress and greater salt intake. Other risk factors include smoking, obesity, high cholesterol, and being of black descent. Hypertension is frequently asymptomatic, which creates a significant healthcare risk for those affected. The American Society of Hypertension recommends that everyone know their blood pressure and have it annually checked. The most important prevention factor is physical activity and exercise. Once diagnosed, ongoing management is required despite absence of symptoms, and if symptoms do occur, the patient may be red-faced or dizzy with exercise. If left untreated, nearly 50% of people with hypertension die of heart disease, 33% of stroke, and 10 to 15% die of kidney failure. When a person with hypertension achieves target blood pressure, it must be emphasized that blood pressure control does not equal cure. Monitoring must occur on a normal basis. When treating patients with hypertension, health benefits can be achieved without large gains of fitness. Also, it is important to monitor vital signs before, during, and after the exercise. Hypertension can also develop into congestive heart failure. Congestive heart failure is a condition in which the heart is unable to pump sufficient blood to supply the body's needs. Treatment of congestive heart failure remains difficult and the prognosis is poor. To achieve maximal benefits from any therapy, symptoms must be recognized early and interventions initiated. Exercise capacity is the most powerful predictor of survival in congestive heart failure patients. Symptoms include shortness of breath, system vascular engorgement, tachycardia, muscle weakness, and orthopnea. It's important to monitor blood pressure to detect heart failure. Observe the patient for decreased blood pressure and for flat or falling systolic blood pressure in response to activity. Also, the patient may have a normal response to exercise. In any therapy setting, the goal is to gradually increase intensity and duration of the exercise, and the exercise should be avoided after eating and taking vasodilator medications. Endurance and exercise training may have long-term benefits on the congestive heart failure patient. In conclusion, although there are many more cardiac problems you may see out in the clinic, these are two of some of the most frequent ones that you will see. And by being aware of the symptoms, you can more efficiently treat your patient. So I hope you've learned something on the cardiac system. Thank you.